Many people have told us that understanding Medicare is confusing and overwhelming. Well, it doesn't have to be that way. In fact, we have the formula to make it much simpler, and we're going to share it with you today. Are you ready? First step, decide what form of Medicare is right for you and then only explore those types of Medicare plans. This will help you from being overwhelmed with all of the many choices that are available, and you can then concentrate on the benefits that are most important to you. If you learn one thing from this video, it's the fact that people have two distinctly different ways that they can get their Medicare benefits. The first on the left-hand column is the default way, or Original Medicare. Original Medicare consists of Part A, the hospital benefits, and Part B, the medical benefits. Many people that take Original Medicare will take an optional Part D prescription drug plan to help cover their drugs, and many people will also take a Medicare supplement policy to help cover some of those things that Original Medicare Parts A and B do not cover. That's the default way. That's the way that Medicare was for many, many years until the allowance of Medicare Advantage plans, or Part C of Medicare, which is on the right-hand column, and that's the second distinctly different way that people can get their benefits from Medicare. Medicare Advantage plans, simply put, combine Parts A and Part B medical benefits together. So there's the hospital part, the medical parts of Medicare together in a plan that's administered by a private insurance company. The plans can have a Part D included, or they can have a Part D plan that's separate. But those are the two distinct ways that people can get their benefits. There's positives and negatives to each way, and if you can first make the decision of how you want to get your Medicare, that will take you a long way down the road, because that will keep you from getting overwhelmed by all the plans, and then you won't get the two types of plans mixed up, Medicare supplement plans and Medicare Advantage plans. So the first thing, and probably the most important thing in your Medicare decision-making process, is to decide how you want to get your Medicare, either Original Medicare with an optional Part D and supplement, or the plan's benefits wrapped inside of a Medicare Advantage plan delivered by a private insurance company. At this time, we're going to break down the two different ways that you can get your Medicare and look at some of the pros and cons of each one. Let's focus first on Original Medicare. There's a line in the center of the screen, and above that line would represent how Original Medicare works with supplements and Ds, and below that line is how Medicare Advantage works. We're going to focus on Original Medicare. Let's say that you had visited a doctor or had a hospital expense under Original Medicare. They would send the bill either to Part A or to Part B of Medicare, depending on whether it was a hospital claim or a medical bill. Medicare would then pay the doctors and hospitals the portion that they would agree to cover, and technically you would be responsible for the balance. That's why people under Original Medicare many times purchase Medicare supplement policies. With that in force, Medicare would pay towards the claim first, and then Medicare would forward the bill directly to the Medicare supplement policy, and they would pay also on the claim. So you have both Medicare paying on the claim and a Medicare supplement policy paying on the claim. That can leave little or maybe even no out-of-pocket expenses. If you take your Medicare under Original Medicare with a supplemental policy and you want prescription drug coverage, you would need to purchase a separate Part D plan, because Original Medicare nor a Medicare supplement policies cover drugs. The benefit to Original Medicare paying and a supplement paying is there can be little and sometimes even no out-of-pocket expenses. The con to that side would be you're paying a little bit more premium to get that type of a policy. So those are the pros and cons of Original Medicare and a Medicare supplement. Now let's examine our Medicare Advantage, or Part C of Medicare. Look at the same scenario. You visit a doctor or have a hospital bill, but this time you're in a Medicare Advantage plan. Although A and B Medicare is still there, it doesn't disappear. You're not disenrolled from Medicare, you're simply enrolled in a Medicare Advantage plan. So the doctors don't send the bill over to Medicare. They bill the plan directly to the Medicare Advantage Part C plan. So they send the bill directly to the plan. The plan pays back according to the outline of benefits or the evidence of coverage booklet, and then you pay whatever copayment or out-of-pocket expense that the plan tells you for each category of service that that you might use. The positive or the benefit to these Medicare Advantage plans is you pay money into Medicare for your Part B premiums. Some people have the state pay it, but in any case, there's money going into Medicare. Instead of Medicare using that money to spend it to pay claims to doctors and hospitals, what Medicare does is they pay subsidy money directly to the companies who run these Medicare Advantage plans. So they compensate those plans for the administration. Those plans take the money that they get from Medicare, they cover their out-of-pocket expenses, and they make a profit on administration. The benefit of a Medicare Advantage Part C plan is the fact that because Medicare pays these companies, you can enroll in a very low monthly premium. In some cases, in some counties and states, there's literally plans for zero premium. You don't have to pay anything other than what you're already paying into Medicare. The con to that would be when you use doctor services or hospital services, you might be responsible for more of an out-of-pocket expense than you would in the other scenario that we talked about under a Medicare supplement. So for a person that's using very small amounts of services, a Medicare Advantage plan becomes very attractive because you can be enrolled for a very small premium and you can pay an out-of-pocket copayment that can be very reasonable, $15, $20 for a primary care physician, $30, $40 for a specialist. You might pay a few $100s for the first few days of the hospital, but the coverage can be very comprehensive if you have a large amount of out-of-pocket expenses. They do have out-of-pocket limits that can apply. So again, looking at the two different types of Medicare, Medicare with a supplement has two insurances paying. There can be little or no out-of-pocket expenses, but you pay more premium. Medicare Advantage plans, you can be in for a very low premium, but you might pay more when you go to use services. So those are the breakdowns and the pros and cons between the two different types of ways that you can get your Medicare. And we're going to go into just a moment how to start taking the time to decide which way you want to go. When considering the difference between original Medicare and a supplement policy or a Medicare Advantage plan, there's a few things that you want to take into consideration when you're making this big decision on which way you want to get your Medicare. And again, we can't say that it's an important decision to make. If you can make that decision first, then you can concentrate on those plans that fit your situation. The first thing to do is consider what your current health plan is now. Most people are coming from a group insurance or from a spousal group insurance. It might be an HMO, it might be a PPO, it might be similar to one of the Medicare Advantage plans that we've just described, where you pay an out-of-pocket expense when you use a service, but it might be something affordable. The second thing to look at is the amount of medical services that you're currently using. If the only thing you've done in the last few years is gone to the doctor a few times, then you're probably using small amounts of services. If you're already using large amounts of services, having hospital stays and oxygen medical equipment, then you might want to consider the more comprehensive type of a policy like a Medicare supplement. Pay more up front, but little or no out-of-pocket expenses for the services. Consider how much you pay for the medical coverage now. If you're paying a large fee to cover a spouse under a group insurance, and now you're both going on Medicare and you can get released from that, take the money that you're spending now, you might be able to afford a very good Medicare supplement and Part D plan for about the same, maybe even less than what you're paying for right now. That's a great way to go for people that are coming and paying from a group insurance currently. Consider who's covered under your current plan. If you're covering a spouse or children, Medicare Advantage plans are not going to be a family plan. They're going to be individual policies. The only people that are going to be able to be covered are those people that are eligible for both Parts A and Part B of Medicare. So if you have other people, you might have to be tied to that group insurance, or however you're doing it now if you're covering spouses or children that are under 65 and that are not on Medicare. Obviously, we're there as a health coach for assistance, and that's why we put this video together. We're here to answer any questions that you have on those individual circumstances that everybody seems to have. We'll talk more about that in just a moment. You're on the right track by using the educational format of our website to get educated so you can make the right decision. We're available for help 8 a.m. to 3:30 Eastern Standard every business day, 800-332-7557. If you want a health coach, we can assign one of those to you to help you make the decision-making process a little bit easier according to your individual circumstances. Everybody's going to have those things that aren't going to be addressed in this format. You can join webinars on Medicare Advantage products or Medicare supplement products specifically. We can give you a quote using your state, county, and zip code information, or just email us at help@65medicareinfo.com. Thanks for tuning in today, and again, you're on the right track by getting educated. We're there to help if you need us. Continue your education process, and when it's time to look at those specific health plans, contact us, please. Thanks.